Thank you so much, Arlen. This is just so wonderful to be here today. Thank you so much for having us. We are in Suicide Prevention or Awareness Week, so I appreciate each of you that are taking the time this week to attend this webinar, and I hope that you come out with great resources or at least some ideas and some more knowledge around suicide prevention in schools, mental health literacy. My information is here on the first slide. Again, my name is Shantal Saldana with my email, shantal@ericaslighthouse.org. Please reach out after this webinar if you have any questions. I am part of the education team at Erica's Lighthouse, and I'm the manager of school outreach. And what I do is I do this type of event, whether that's in person or virtual, to try to connect more and more school professionals to the resources that Erica's Lighthouse has. Everything that we do is absolutely free. We are a nonprofit. And very importantly, I want to point out that on this screen here, you'll see that QR code. This is where everything that I will talk about today lives. So when you scan that with your phone, it will take you to a form to create a resource portal. So I would advise you, if you can walk out of here with all of these resources to bring back to your schools today, you can scan that QR code. You can also just go directly to our website and sign up there. And then I have this QR code and a couple of other slides and at the end. So I just want to invite you to take that with you today. And I want to start. I know it's like 3 o'clock. It's almost the end of our day, almost the end of our week too. So I just want to start with a little exercise. We call these 5-minute recharge sessions, and these are meant to be used in the building, mainly with schools, but by all means can be used with staff. For the purposes of today, we're only going to be doing a 2-minute. I'm going to shorten it up. And then if you want to just take your own time after the session and do the full 5 minutes, or if there's something you felt like you still needed to think through, by all means, do so. These are meant to show students that mental health is just so important. And then it is important and necessary to take a break, to recharge when you feel like you're not charged anymore, when you're doing any sort of task, and that's academic or just, on your personal level. So what we do here is we take 5-minute classroom breaks to boost mental health. When you go on the program here, you have about 8 or 9 different sections. So like breathing exercises, you have visualization exercises, resting, exercise mindfulness, journaling. I just chose one, but you have 8 different categories, and each of these 8 categories has 6 or 7 or 8 activities all pertaining to that category. So it's just a great tool to utilize. What we're going to do is we're going to visualize a solution. So I'm going to set a timer again for 2 minutes. And what I want you to do is, whether you want to close your eyes or not, I want you to think of a mental health problem that is, related to you, your school, your district, maybe in the state, a mental health problem that you see that you're facing. So we're going to visualize a solution to the problem. And again, you can close your eyes for this, but what I want you to do is I want you to think of what steps you take. How would you solve this? What obstacles do you overcome? And then what the outcome looks like. So really visualize yourself solving this problem, and then just let the positive feeling, that effect of completing something, accomplishment, right, wash over you. So I'm setting the 2-minute timer now. There we go. So again, mental health problem you, your school, your districts, your state is facing right now. Remember to break down the steps. What do you take? What obstacles do you overcome? And then what is that outcome? What does the solution look like to you? You have about 1 minute left. Don't forget to think about what that feels like when you accomplish something. So when you create a solution for this problem, keep those positive feelings of accomplishment just wash over you. We have about 10 seconds left. All right, so now I want to just invite you back. If your eyes were closed, open your eyes. Just think about, any stress that is related to trying to solve this problem, right? So take a deep inhale and then exhale. And then if you really need to, for me, I like movement. So shake your arms, right? Like roll your shoulders, whatever you need to do. Sometimes it's just really nice. And we don't find even 5 minutes to stop, recharge, and think. And as you know, for all of our youth, sometimes they're on the go. So making this a practice that they can see in their building, that they can see in their schools, and maybe hopefully at home, really creates a difference. Today, we're going to look at some statistics around youth mental health, learn about a mental health literacy model, identify the benefits and the purpose of mental health literacy in schools, recognize the skills that the students can develop with depression education. And then I'm going to talk to you about some programs and resources to get you started or to fill in those gaps where you might feel like you're still needing some support in your building. So I have a couple of hands-on activities that will be presented so that you can bring these back to your schools. So I wanted to start first with that activity, but again, to continue introducing myself, I've been with Erica's Lighthouse for about 2 years now, but I've spent about 12 years working with families, children, youth, always with the goal of improving well-being, their well-being overall. So I currently work with Erica's Lighthouse. I connect schools and resources to help schools really create inclusive environments around mental health. When I'm not presenting, I like to take care of my mental health by dancing salsa, walking my dog, or every now and then a few karaoke nights. So I hope that you can think of just everything that you'd like to do to take care of your mental health this week. If you're not familiar with Erica's Lighthouse was founded in 2004 after the loss of Erica. Erica was a 14-year-old who lost her life to her depression. So we're an organization that believes that every student deserves good mental health. And we're dedicated to educating and raising awareness about adolescent depression, encouraging good mental health, and breaking down the stigma that surrounds, still today, mental health issues. We provide free mental health programs for any school, anywhere. We are here today because youth are in mental health crises. We're experiencing this. We have experienced this throughout many years. But really, every time you read an article or whether that's on your phone, on your email, we always come across articles that just give us insights into what youth mental health looks like right now. The latest CDC survey data released showed us that in 10 years, really mental health has declined. And then just from the last report 2 years ago to the latest report that they released, we haven't really seen a lot of improvement. Maybe there's a tiny little bit, but no, right? We still have about 40% of students who say they experience persistent feelings of sadness and hopelessness. We still have around, I think it was 30% before, now it's 29% who experience poor mental health. 20% who seriously consider suicide, 16% who made a suicide plan, and 9% who attempted suicide. The report also highlights that female students LGBTQ plus students and students who had same-sex partners were more likely than their peers to experience poor mental health and suicidal thoughts and behaviors. And this is why it's important that we focus on we bring these resources and education to schools. We know that schools are in a particular great place to identify students early. We know that 15 to 20% of young people will have major depressive episodes before they reach adulthood. That's nearly, that's 1 in 5. That's about around 5 in a class of 25, if we're thinking kind of in a classroom setting, right? That's a lot. And we know that 50% of those will have symptoms before they turn 14. So this is why, again, schools are particularly positioned to identify students early, get them to the right help, get them to the help they need, and most importantly, that they deserve. There's a lot of people who struggle with depression. And while suicide is actually rare, when it happens, it's very tragic. It affects more than the family, it affects the community, right? If you lose a child to suicide, the entire school community and the entire community itself, it is a tragedy. So here in this chart represents a school of around 2,000 students. So the black dot in the middle represents one life lost to suicide. Surrounding that circle, we have about 180 students, or 9% of that population, who will attempt suicide. Then surrounding that one, we have about 20%, or around 400 students, that seriously considered suicide. About 800, or 40%, who have reported symptoms of depression. And when asked, about 70% of students believe that anxiety and depression are serious problems among their peers. And then almost all recognize that anxiety and depression are problems among their peers. So the difference there is 70% believe they're serious, and 96% does still identify them, but perhaps they don't qualify them as serious. So not all depressed kids are going to attempt suicide, but by being aware and talking about depression, really focusing, what we're doing is we're really focusing on identifying struggling adolescents before they get to the point of taking their life or suicidal ideation. So classroom programs offer one piece of, what we need here, but really it's more about a suicide prevention model. So moving on, I just have a question here. So I'm gonna have you use, if you can participate with, I believe on Zoom here, we have the reactions. What are my options here? Okay, so I think you can either raise a hand, because the other one is a clap. Yeah, so we're gonna use a raise hand if you can find it somewhere here. I wanna see like how many of you are feeling a bit overwhelmed by student mental health? Thank you. I'm just going in here to my list. So I see a couple of hands. Thank you. And this looks like many different things, right? It can be just a student needing help, or even just a lack of services, a lack of staff, lack of support. So many are experiencing this. Your typical mental health model looks like this, right? There are many schools that have and implement SEL curriculum, SEL practices early on. And then from there, we switch to suicide prevention, right? So schools implement SEL programs. We know they include the 5 core social emotional competencies, so self-awareness, self-management, being responsible in decision-making, social awareness, relationship skills. So there's much effort placed into these programs because we know that SEL programs foster healthy life skills, right? Foster well-being and also positive school environments. From there, schools understand that SEL serves as part of a suicide prevention strategy, right? A bigger strategy, and they move right into it. So, teaching straight about suicide prevention. And again, using kind of like that raised hand, I think mine is still up, so I might have to click on it again so it goes away. But I want to see again, just with the lower hand. With the raised hands, or even if you could just put it on a comment, right? Like how many of you are operating under this model? or maybe a school that you were with. I do see a hand go up here. Thank you. So let's think about the gap in between there, and that we need to kind of just address, right? This sits in the middle. There's a big learning gap that needs to be addressed so that we have, not we, with students have better understanding of mental health, right? There, there perhaps has not been enough scaffolding for students to have that necessary knowledge around mental health to even understand why suicide prevention is important, right? So how can we discuss suicide with students without them understanding basic definitions of mental health, right? Why is it important? What are the challenges that they can come across? So, for example, we know that often mental health is really not extensively discussed at home. In many cultures, it's just something that's not talked about, right? There's a stigma behind it. So, have students even been exposed to other language around mental health, to opening these conversations, to that type of language? And then have they had opportunities to discuss their mental health? So just some things to think about. So now here is a tier 1 mental health literacy model. So you see on the left side, we have SEL, right? It's a foundation. It's a great way for students to build life skills. It's really well set there. Now, good mental health is an outcome of social and emotional learning, right? So in the middle, we're going to see mental health literacy. And this is through our model is through depression education. When we introduce depression education as part of mental health literacy, we're utilizing depression really as a gateway conversation to other mental health topics. So this is a good point to start. And then many of us, as well as the students, have really come across this term. So this is something that might look a little familiar to them, right? Either they have heard the term depression, they might misuse it and say, oh, I'm so depressed because I didn't make it to the team. Or maybe they know someone in their life who experienced depression and hopefully and maybe has talked about it. So, right, I think a lot of us can raise our hand if I were to ask you, do you know someone with depression? Have you struggled with depression? Or do you know someone just close going through depression, or if you've helped someone? So what we're doing here is we're utilizing it as a gateway conversation. We're opening up those lines of communication with students, and then sharing information as important of, signs and symptoms of adolescent depression so that they can recognize that in themselves and also in their peers. And then from there on the right side, you'll see that then we have suicide prevention, which then has a better basis to build on. So now let's dive a little deeper into what mental health literacy really entails. According to the Mental Health Literacy Collaborative, it is often missing educational component in schools. So mental health literacy is us understanding how to foster and maintain positive mental health throughout our lifetime and through our different stages in life, right? It is knowledge about common mental health disorders. Mental health literacy includes knowing signs and symptoms of mental health issues and also what the treatments look like. So just knowing and having general knowledge about what is there. Also how to seek help effectively. This is a big part, right? For some of our students, we find that they might even have a hard time like asking for help for their homework or at home for other things. So imagine what it looks like to not know about a topic and know that you need to seek help, and now not knowing how to even effectively seek that help. And then knowing about stigma, right? Stigma and knowing strategies to reduce or combat stigma. Mental health literacy in action looks like this, right? So understanding how to foster and maintaining positive mental health includes things like knowing about sleep and how it relates to mental health, exercise, nutrition, understanding positive coping mechanisms, and also, just like the exercise we did at the beginning, understanding what works for them, right? What positive coping mechanisms they like and it works for them. Then as part of understanding common mental health disorders, right? What is defining mental health? What is mental health? Learning the difference between when feelings are just everyday feelings, and then we can, do something to make us feel better if we have a bad day, or realizing that these are overwhelming feelings and that perhaps whatever we tried to do is not working, right? Also understanding stress, understanding anxiety, and then depression. As far as understanding how to seek help, this can include, learning how to find a trusted adult. So who are the trusted adults? Where can I find one, right? At home, in the community, at school. So who are trusted adults? Where can I find them? How to ask for help? How to talk to a peer? Because many times a peer will tell, will make a comment, or at least will tell a peer as a first person that they might not be feeling well. So we really need to have them understand how they can help a peer. And then help seeking might not be easy. So again, what do the steps look like one by one, and why is it important to seek help? And then as far as understanding stigma, or what are examples of stigma? Mental health stigma is just one of the stigmas that we have to combat in schools, right? So normalizing conversations around mental health, doing school-wide activities that promote good mental health, which then normalizes conversations and then boosts stigma. And then family engagement. We need these families to be in on the conversations with schools and with students, but also to have the tools that they need to educate themselves and their kids around mental health. And then last, we have staff training. We want to make sure that everyone in a building feels like they can recognize signs and symptoms of adolescent depression. They feel confident in knowing how to be a trusted adult. What is their role as a trusted adult? And feel comfortable with navigating conversations and understanding that their role is really to get the students to help, and it's not really to be their therapist or to have solutions for them. Mental health literacy is essential. We believe it's essential as scaffolding to get to suicide prevention. So again, here, SEL, this is your knowledge and skills from SEL. Those are all the skills that students have learned in past years. Then we're slowly adding a little vocabulary around mental health. We're giving them opportunities for discussions, opportunities to hear others' stories, teaching skills to maintain good mental health, teaching signs and symptoms. We want them to know the mental health. Like, we don't always have to talk about the negatives of mental health. It's really, we all have it. It's just like our physical health. We should worry about it just as much as we worry about it if we are sick, right? We run to the doctor, we talk about it, what happened to us. If we break a bone, we go to the ER. So understanding really how to maintain good mental health, but also that it's just typical for us to talk about this. So in this form, what happens is that students are able to understand and respond to suicide prevention education in a better way. So here I have some skills that are developed right through each of these kind of categories and how these just grow across the model. So as you can see here, we've listed the SEL, and then in the middle we have mental health literacy, which in this model is depression education. What are we adding on? And then suicide prevention. So in suicide prevention, then we're adding things. So everything I kind of just said before, and then we're adding like crisis intervention, more on peer support, more on signs and symptoms of suicide. So not just now depression, but really of suicide. And then what suicide risks. So with that same little raise of the hand, who feels like this is a better model? I have to go back to my participants here. Perfect. Thank you. So what I'm going to show you here is the programs that we have available. And, with this, we work on this 4-pillar model, understanding classroom education, clubs to empower students, family engagement, and then staff training. You might already have some of these tier 1 prevention strategies in place in your building, but perhaps you can acknowledge that there's a little room for growth always, right? In the tier 1 space, we can always do a little more, or we can fill in the gaps, or we can, do things different. So here's just everything that we have available to you. Again, all of these resources are free. There are 4 programs. Of course, we feel like once you have hit each one of those pillars, you're really creating those inclusive school cultures around mental health. But again, these can be standalone if you just want to do classroom education. If you feel like what will be really strengthen this model will be you adding family engagement, then you could just add that. So very, very flexible. Here are the 4 models just in a different format, right? We have SEL, and then we have level 1, level 2, or level 3 of our classroom education. So we go from 4th grade all the way through 12th grade through these 3 different curriculums. And then on the bottom, we have these other pillars that, again, support, having a club, engaging families, and making sure our staff is trained. So all of our programs for classroom education are approved and under the Suicide Prevention Resource Center Best Practice Registry. You can find them there. So level 1, ideal for 4th through 6th graders. It is bilingual in Spanish and English, and we all have mental health. It's an introduction to mental health by understanding everyday feelings versus overwhelming feelings. And then it has a strong focus on teaching students how to seek help and how to have good mental health. Then level 2, ideal for grades 5th through 9th. Again, English and Spanish available, and it's depression awareness. So it's this introduction to depression, signs and symptoms, equipping students with signs and symptoms, strong focus on help seeking as well, and how to maintain good mental health. And then level 3, which we believe it's ideal for 8 through 12. And when I say we believe it's ideal, it's because you know your students best. You know what they need and what they're ready for. So these are very flexible programs. So introduction to depression and suicide with a strong focus on help seeking good mental health. What that curriculum looks like is they're all video based. Level 1 is one that it's cartoon based, and it's like a 5.5 like 5.5 minute video, and you can watch it in Spanish and you can watch it in English as well. And this is really what the students watch. You have 2 different options. If all you have is 1 day, we have a 1-day lesson available. And then we also have what we call the full program, which divides into 4 sessions. So those 4 class periods. Those can, be about 35 to 40 minutes. So for all of these, you have a video that is a lesson, and then facilitator instructions, your slideshow, handouts for the students, some tickets at the end to kind of like recap. And then we have student bookmarks available so the students can walk away with the resources or good mental health tips. That's what the bookmark has. Level 2, for both level 2 and level 3, we have real teams that look and sound like the students in your buildings. So I think that really captures a lot of them because one of these stories really might resonate with their life, what they're going through. So introduction to depression, as I'd mentioned, recognizing signs and symptoms, and really I think for the purposes of time, I'll see if at the end I have some time. This is just like about less than 2 minutes. It's just a teaser of the full video. The full video is about like 16, 17 minutes. It breaks down for the students. But if we have time at the end, I would really just like for you to just hear what these messages sound like. They're all very, very positive. And we did not scrape the stories for the students. They're just, their stories with how depression came about their life, and then also who helped them, what helped them, and how they continue having good mental health. For this level 2, we have the same options. We have a full program that breaks down into 4 sessions or just a 1 day. And then the thing that is different about this one is that we offer a self-referral card. So beginning with this level 2 and then also level 3, we have a self-referral card. This is flexible and optional for you to use, but it is a tool that helps you identify students, or they can self-identify if they want to talk to someone after the lesson. So you would hand one to each and every student. We want to avoid where like, I'm not turning one in because my friend over here is not turning one in. So we recommend that every student gets one. And then we ask them at the bottom, would they like to talk to a mental health specialist in 24 hours, in the next week, or if they don't need to talk to anyone. So once they fill this out, we recommend, of course, that if we're asking students if they want to talk to someone in 24 hours, you don't implement the program in a Friday or before a holiday or during, close to a break. Just best practices on those. And also that you have a plan, right? So that your mental health staff understands that you're handing these out, and they might see an uptick in the amount of students that just want to go and talk to them. What we find often is that students sometimes don't recognize that a peer needs help, and maybe it's not for themselves, but they want to talk to someone to kind of like let them know that they're worried about a peer. So here are all of the students in our videos. So these are just very important because we know that representation matters, right? So these stories are very authentic. And again, the teens are not actors. The three on the bottom, we actually just grabbed their stories and filmed them last year. So very recent stories too. They all have different backgrounds, and we know that your students can relate. Level 3 is recommended 8 through 12, I'm sorry, yeah, 8 through 12 grade. I'm not sure why it says 10. It's 8 through 12. It is fully bilingual, Spanish and English. And then again, it's continuing with information and education around depression, but also suicide. And then by recognizing those signs and symptoms, strong focus on help seeking, and again, continue to have good mental health. Same format, where it's a 1-day, a 4-day, but everybody would have everything they need to implement in Spanish or in English. Now, we know that sometimes one lesson is not enough, or just teaching a 4-day curriculum is not enough. So we do have optional program additions. Many schools, we work with 50 different states. So every school and every district works differently and knows their students best. So there are optional program additions. There's worksheets, like how to overcome barriers, like what are supportive conversations with peers. I really like that one because it helps them understand when a student needs help or when a peer needs help, like what's a helpful response and what's an unhelpful response, and has them really practice these skills. We also have a simulator that is called Text from a Friend. So it's a simulator about when a friend would be in need of help, what would be the best way to respond to these messages. And then also a good mental health Jeopardy game, which is very fun. And I play with staff and the adults all the time. That really, again, just emphasizing some education around mental health, but also like how stress is related, how coping skills are, what healthy sleep looks like, and then also nutrition and why that it's important. But there's tons more of optional program additions that can just be standalone activities throughout the school year. Or if this is all you want to implement, or an educator in your building wants to implement, they can do that as well. Now, as we all know, family engagement, super, super, super important. So this pillar has these resources available. We have a family workbook series. These are workbooks written by parents for parents to understand mental health. I know that still today there's many communities and there's many generations who didn't grow up talking about mental health. They didn't grow up having these conversations, being comfortable, or perhaps they grew up with, thinking like, no, that's something we just don't talk about. It doesn't leave the house, right? So for some, they might know some things around mental health, but really once you have to navigate the system of getting help, it can be complicated, and we know that. So these workbooks, one is we all have mental health. It helps families understand what mental health is, and stigma, being a trusted adult. And then the second one is more of like, when you're concerned about your child, like what should you be concerned about, and then what to do when you're concerned. So there's things like resources like little checklist on that you can keep track of behaviors for your child, like what, these are teens, sometimes adolescents that we're talking about. So we do know that they might be acting a little bit different than when we, when they were younger. So what's typical of development, and then what is not, and what should we really be worried about? And then once we know that we do need help, like what does getting help look like? Navigating insurance, how to get coverage through insurance, understanding what each types of therapist, like what's the definition of a social worker, what's the definition of any other clinician. So understanding what treatments are available, what medications are available. This workbook really helps families understand that and breaks it down in a very easy way. These are all, they all have embedded links in them. So even though they can be printed, but I think their best use is PDF, so they can click on it and it takes them to even more resources. And then we have the family workshops, which these are Family Workshop 1, which correlates with Classroom Education Level 1. And then we have Family Workshop 2, which correlates to our Level 2 and Level 3. So one is we all have mental health. And then both of these are recorded. They're pre-recorded in English and in Spanish. So if your school would like to share these resources with parents, you can share them through a link as a recorded session, But also, if you want to host this in-house or as a virtual call for parents, you have everything that you would need with your facilitator guide, slideshow, video, everything is ready for you. Just needs a mental health champion to stand in front of parents and then give the workshop. So, but again, and we know that sometimes getting parents in to come into those like family nights is hard. So, this is a great way to get the resources to them, and then they can watch it at their own timing. Another really simple, easy tool is this bookmark that you can print and have schools spread that out to parents. These are all of the resources in one bookmark. So all those QR codes are just those books and the workshops that I talked about. It's English, and then in the reverse, it's Spanish. And then those are really easy QR codes they can scan with their phones and see all of the resources there. They're low cost to print for your school. Here's just some copies of supplemental resources that I have within the workbook. So checking in with your therapist, right? Once your child is receiving therapy, like what does that look like and what should you ask? Also, how to start conversation. How do I start conversation with my families? Can we make a good mental health plan as a family, right? Taking this prevention, taking time, let's plan, let's commit, it's almost like a little contract of like, this is what I want to, I'm going to exercise like twice a week, and then like you can fill it out. And then it's inclusive to kids in the family for all ages. Then there's some worksheets on there about like, what should your concerns be? For you to write it down and take these to your doctor. What do I ask my doctor? And also things like more complex things like, what do I ask my insurance as far as like coverage or not coverage? So. Now, within those workbooks also, I have awareness interaction activities. So in our link, I'm going to take just 20 seconds. I'm sorry, my computer is dying. Give me 1 second, please. Let me just plug this in. All right. I apologize for that pause right there. I did not want to lose you completely. All right. So what you have here are awareness interaction activities. So these are focused on normalizing these conversations. So these are a great way and a great tool to get to parents of, activities they can do at home. Some of them are really quick. Some of them can take lengthy conversations or open up lengthy conversations. It really just helps foster trust between family members. From those CDC numbers that I read to you at the beginning, from the report, parental monitoring is a factor to protect youth mental health. So when we're really opening up conversations about where your kids are, right, where students are, who they're hanging out with, all of that really helps contribute to good mental health for youth. But sometimes families have a hard problem even engaging in those conversations. So this is why this type of activity really fosters that communication and opens up so there can be parental monitoring, right? And I'm just going to scroll through some other opportunities that we have within the workbooks, or they can just be standalone activities. So here's a weekly planner. This is great if you send it out like the week before spring break. There's a family journal, because we know that sometimes for youth, speaking is not their forte. They're not going to want to engage in those conversations as often. So maybe they can write them down, and maybe this is just another form of open communication that we can have. Also showing kindness, practicing spreading positivity. We have these kindness flowers that can be done at home to spread kindness within the families, but also in the community. Another thing that we do have available are empowerment clubs. Once we give the students the information and the education, we want to empower them, because they're going to be the leaders in their own mental health. So how can they spread this education and normalize conversations to reduce stigma in your entire building? They can do so through clubs. For Erica's Lighthouse official clubs, we fund them with up to $500 so that they can create activities like the one you see here with this wonderful I think this is this is called a take a compliment. So they put compliments and then they can either add a compliment or take a compliment. So we have a ton of activities that promote different kind of like parts of mental health, whether that's help seeking, positivity, and various different topics. But the clubs really are run by the students. They need an advisor, and then after that, that's all. So if you were interested in creating and starting a club in your school, we have a club coordinator within Erica's Lighthouse that can help you with that. We really want student-powered awareness. They create the education and they really take the action in their own building. So it's really neat to see. This one is an activity called Follow the Footprints. So it does have mental health facts in those footprints. And this is great at the beginning of the school year. Many students don't know where their counselor is or where their social worker is. So these can be an activity that they can lead them to their office, or they could just, you can utilize them in various ways, but really they need to lead them somewhere. And you can decide what that can be, or the students in the club can decide. There's other ones that just share positivity, right? We call this one Encourage Mints, where students hand out mints with little messages on them. And then this one, Creating Empathy and School Connectedness. How full is your cup, right? We often don't see what others are going through. So asking, how full is your cup? Are you overwhelmed? Are you relaxed? Are you feeling stressed? As you can see on this, there were a lot of those sticky notes over by the stress, overloaded, or overwhelmed section. So, just creating that empathy that everybody's going through something. And asking them, how full is your cup? Feeling important about others caring about you. We do have ways to spread also awareness in the entire building by a simple pledge. In the month of May, Mental Health Awareness Month, we have the Positivity Pledge. And this is a school-wide campaign for Mental Health Awareness Month, where every day it tells you what to do. Every week focuses on a different topic. So reflection, mindfulness, exercise, gratitude, or nutrition and well-being. And students can take charge of this whole month and create that inclusive environment around mental health. And then this week is Suicide Prevention Week. This is Give Voice, our school-wide campaign for Suicide Prevention Week. It can be utilized any week. It's just that we promote it for this week. And then lastly, before I get into questions here, I want to introduce you to our last pillar, who is policy and staff training. It's very important that all of our staff feel comfortable around the topic of mental health because they see the students so often. And it's just in our benefit that they can know how to recognize signs and symptoms, that they know how to be trusted adults, and they know what to do when it comes to getting help for a student. So this is a reminder for those of you who are familiar with the MTSS foundational best practices. That does include staff professional development, right? Creating a positive school climate and culture. So what we have available is one, when we're saying that we care about mental health, we want to make sure that it's not only the students, but the staff. So we do have staff well-being activities that can be utilized throughout their building. And then we have staff training. This training is through our LMS system. So on the resource portal, you can go in and you can take this training or go back to it as many times as you want. But also we have an option to host this within your building, within your entire district. So you would have the facilitator guide and all the PowerPoints and everything that you would need to host a group and to train all of your staff. We want everyone involved, right? We need from those educators, from those mental health specialists, to any educator, to your health educators, to everyone that works in the lunchroom, to the bus driver. We want to involve everyone and make sure everyone has the education and the information that they need around mental health. And then last, this is very, very new to us, just launched this school year. So it's only been running for a couple of months here. We have a new free data center. So data center that you can access if you want to make data informed decisions is here. So we do have a school culture survey data, a survey that goes out to students, families, and staff to kind of gauge the culture. And then we have a tier 1 assessment. What the tier 1 assessment does is if you complete this, you can get a recommendation at the end of those areas that are currently being implemented in your building, and then some recommendations on what you can do better to kind of target the different areas of tier 1 prevention model. And then we have pre and post data for students. So if you really want to see if these classroom education programs are effective, can very easily access that by doing a pre and a post test and see the difference it creates, right? Even just from a student taking a lesson, but also across different years. So that is all available to you for free. And then also we have pre and post data here for staff before or after taking the staff training, as well as for families. So accessing all of these free resources is the QR code I showed you at the beginning. If you go to our website, ericaslighthouse.org, there is a little yellow button there. It says just register for free access. You create your profile. It gives you like a username and a password, and then you can go back and look at the resources anytime you want or need or share them. And then if not, you can scan the QR code on your phone right now. And then with that, I'm going to leave the slide up, but with that, I just wanted to open it up for questions. And I haven't checked the chat in just a couple of minutes here, so let's see. Thank you, Arlen, for putting that link on there. Does anybody have any questions, anything that they want me to go back to? I'm going to switch back and forth to my other slide too. Just so you have, our Vice President of Programs takes care of all schools in Illinois. She has a lot of knowledge about how different schools are utilizing the resources and what works, what tweaks there is. Again, we work with 50 states, so Katie can really help you with a school specific to Illinois. Her email is katie@ericaslighthouse.org. And then I can also just help you and connect you with the right person at Erica's Lighthouse. We're a small team, so we're always happy to help and jump on a one-on-one call and walk you through the resources. Also, if you go to our website, the first Thursday of every month at 10 a.m. Central Time, I host a resource portal walkthrough. And this resource portal walkthrough I basically go on the resource portal itself. And then you can see the resources there for all 4 pillars. And I click in and out so you can see what those look like and how easy it is to navigate. And then
Excellent, Shantal. Thank you so much for sharing all these wonderful resources, all these strategies for SEL and suicide prevention, and just helping us become more mental health literate. I think that was really appreciated by our group. Feel free to type any questions or comments, any thank yous you've got for Shantal into the chat as we wrap up our webinar here this afternoon. As I mentioned before, I recorded this presentation. I'll be putting it online for you and anyone who registered to access. Hopefully get that to you tomorrow, as well as an evaluation that we really appreciate your feedback on the presentation itself, and I'll share with Shantal. And then we'll get you, of course, the ISB Evidence of Completion form for getting your 1-hour professional development credit for attending this afternoon. I'm going to go ahead and stop the recording.